So, what do you do when the patient is sore after an adjustment or after whatever care you provided them on that day? This is a good question. This came up on a call recently. He says, I injured a rib on one of my patients, and after the ordeal, she decided not to continue care with me. I'm just reading my notes from the doctor. I fully understand her concerns. It was okay to have her discontinue care. Her daughter came to see me and started care with me. I asked her how her mom was doing. She said she's still having her usual pain symptoms and is relying on pain meds from her MD because her condition can't be helped. I didn't put up an argument with her because of the rib incident. Truth be told, her mom was a terrible patient, always late, always questioning everything I did, and I was happy to let her go. I know I shouldn't think like this, but if you really don't vibe with a patient, is it okay to let them go? And should you? So first of all, it's your practice. You can do anything you want. You don't have to care for somebody who walks in. You have to be responsible as a doctor, and part of that would be involved in referring them out. So just completely abandoning a patient is not part of the process. But you don't have to care for them. This is your practice. You get to do anything that you want. So just addressing that back end question, if somebody comes in that you don't jive with, just say, look, I don't want to take care of you. I'd like to refer you somewhere else. Would you like me to do that? I can't imagine too many circumstances where this is the case, but I had a guy came in one time. This was years ago, and seemed like a great guy. I started adjusting him, and we hired a new staff member, and she came in and she started bawling when this guy came in, and she said, I need to leave. And as it turns out, he had beat her bad. And so I had a decision to make. And so I decided I wanted to keep my new CA. And I said, your presence in our office makes her too uncomfortable to accept, to take care of you, to continue taking care of you. And so I just referred him to another clinic. He wasn't happy about it. I got a complaint about it, but it is what it is. I think that was the right thing to do. But again, it's my office. In fact, when I talked to talk to people about it, I just said, look, this is my office. You get to make a decision about who you serve, what product you sell, what product you don't sell, how much you charge. That's your privilege of having your own office. The other part being is, well, what happens when somebody gets sore after an adjustment? A rib is sore. They get a headache. Their back pain is sore. I mean, there's a couple different possibilities. One is that their body has a good response to it, and part of that response is that they're a little bit sore. But I think it's good if you tell people in advance. So I tell people during my doctor's report, I say, people ask me, is there a chance it could be sore? And my answer is yes, it can. And it certainly doesn't happen all the time, and it certainly doesn't happen the majority of the time. But I don't want to pretend that you can't be sore after getting an adjustment. Just like I don't want to pretend you can't be sore after going to the gym. You can. You can feel it the next day. It'll always be transient. It'll always go away, but that's the case. And then when I talk about from an adjustment, you have to go through. You have a informed consent for a reason. And we treat informed consent like it's a nuisance. The informed consent is there to protect you too. It's there to help people understand that there are inherent risks to everything with the human body. We can't possibly know all of the underlying factors in somebody's clinical case as we get to know them. People make mistakes. People respond differently. That's the way that it is. So if somebody's sore, own it. Don't automatically go to, are you doing your exercises, or you didn't stretch enough or whatnot. Like if you hurt somebody's rib, own it. You can apologize that it happened to them, and not an apology like you made a mistake, but I'm really sorry that this happened to you. And then deal with it as if they were a new patient coming in with that injury. How would you take care of it? How would you treat it? And the communication standpoint is huge. You should be communicating before they start care that those things can happen. And if they know it, then it's less likely that they'll just not show up and not come back, as in this case with this doctor, but that they'll come back and talk to you about it and say, look, doc, I'm really sore. What do I do? And so number one, they get sore, own it. Number two, treat it as if it's a new injury of somebody you never met before. They come in and they have this injury. How would you take care of it? And number three, it's your office. You can do anything that you want. Have an awesome week.